Hi everybody, this is Dr. Ravindran Kumeran from Apollo First Med Hospitals in Keel Park. So in this topic, we're going to discuss about what emergencies somebody may face with pancreas. Pancreas is an organ which secretes juices which are responsible for digestion and also hormones such as insulin which control the sugar level of our body. Pancreatitis is a condition whereby the pancreas gets inflamed. The gland itself gets inflamed and can present with very varied symptoms, often kind of necessitating hospital admission as an emergency. So the biggest triggers for pancreatitis are alcohol abuse and gallbladder stones. Both of these can trigger pancreatitis and most patients will fall within this basket. Pancreatitis can be sometimes difficult to diagnose, especially if you have a very sick patient. You start thinking of other diseases and you ignore the fact that they've got pancreatitis. They often get referred to a cardiologist because they think they're going through a myocardial infarction. They become so septic, they think there is generalized infection because of other reasons. So this may sometimes require a CT scan or varied blood tests before you kind of narrow down onto the diagnosis. Pancreatitis 100% requires hospital admission, often requiring ICU stay for a few days, sometimes rarely even requiring surgical intervention, especially if it is because of gallbladder disease, in which case the gallbladder has to be removed on that admission, and endoscopic interventions to remove gallstones from the bile duct, which will be the trigger for pancreatitis. People often think pancreatitis is only associated with alcoholism, which is not the case. As I said, gallstones are a big contributing factor, and there are rarer causes, and rarely you have a condition called as chronic pancreatitis, where you have individuals who've been having recurrent episodes of pain over several years, succumbing to it in the long run. Chronic pancreatitis sometimes can be associated with no apparent cause. Patient can never figure out why and what is actually triggering the problem. That is a very rare and difficult problem to live with. Overall, any severe abdominal pain, I think the first thing we need to do is to rush to an emergency, preferably in an ambulance if you are in a lot of pain. Self-driving may not be the most appropriate thing to do in that occasion. Thank you.